So what's the best optometry mode of practice? Well, in this video, I'm going to share with you 9 optometry practice settings for you to consider. And make sure you watch till the end where I share with you some critical tips to determine which mode of practice is right for you. Hey guys, I'm Dr. Ryan Corte, and this is Ryan Reflects. On this channel, I share with you actionable personal development content as well as my thoughts on trending topics and common life experiences. If you're new here, hit that subscribe button. Also, throughout any point in the video, make sure you check out the notes and links in the description below. What's fun about this video is I've practiced in a number of different practice modalities. So I worked in private practices and corporate subleases. I've worked in OD, MD settings, in VA medical systems, in nonprofits. So I have a lot of different experience in various practice modalities that I hope you'll appreciate. So before I dive into the heart of this video, I want to share with you the fact that there is no perfect optometry practice setting. Wait a minute here. Isn't the video about best optometry practice setting? The reality of the situation is we're looking for the best optometry practice setting for your particular situation, right? There are a lot of modes of practice. We'll look at 7 clinical modes of practice and actually 2 non-clinical modes of practice. All great options, so let's take a look. The first practice setting on the list is private practice optometry. When you own your own private practice in optometry, you can kind of control your own destiny. You are in complete control of the patient experience and the care that you provide. What's pretty cool about that is you also are running your own small business in your community. So you have the opportunity to employ people that live around you. You have the opportunity to control that complete patient experience. And it all falls on your shoulders of how you run and operate your office, or from the clinical aspect to the business aspect to everything in between. And those who run private practices or own their own private practice, the ones that do the best tend to be self-starters. They tend to be forward-thinking. They tend to have a little bit of business acumen, or they tend to be those people that are lifelong learners and learn on the fly. I find that the best private practices learn from their peers. They network and they join these big groups to decrease their cost of goods and increase their ability to compete in a competitive marketplace. But private practice optometry has a lot of opportunity in it. It always has and it always will. And it's a great practice setting for you to look into. Of course, it'd be silly if I didn't mention the fact that private practices are getting bought up by venture capital groups across the country. The landscape has become more and more competitive over time, in particular in regards to acquiring new patients based off of the way that vision care plans have kind of evolved as well. And so if you are looking to get into private practice, keep in mind, if you run your own office, let's just say you start cold, it won't be easy. If you buy in, you gotta win over the existing patient base and community. This isn't an easy route, but it's certainly a rewarding one. The next practice setting on the list is a corporate sublease, and I like to think of it as subleasing space next to or adjacent to a corporation that you're in partnership with. And the nice thing is the space is provided, the equipment on site is provided, and support for that equipment is also covered in your sublease agreement. You can also tap into the power of a larger corporation's marketing budget, which can help drive a number of new patients to your office. And I like to think of it as really running a private practice in a setting where you don't have to worry about the optical because your partners do that for you. And so I personally love to focus on providing high quality care and high quality services for our patients. And at the end of the day, we win them over to be their eye doctor based on that care that we provide. A few things to consider, of course, right? These sublease agreements have a number of things included in them, including hours of operation. It often includes hours, weekends, holidays, things to consider there. Also, at the end of the day, you do not have the ability to sell glasses, and in most of them, contact lenses or sunglasses. That's just based off of the agreement that you have with that corporate entity. But if you really truly want to be focused on the care you provide and you want to have control over that operational perspective of your office, a corporate sublease is a fantastic option to look into. Me personally, I'm very happy in this practice setting. I think it's important to point out that both private practices and sublease practices have doctors that work directly for them. So you can be an optometrist that is employed by a private practice or employed by a sublease practice. And that is actually another modality to highly consider, because you're essentially working for a small business and you have the opportunity to really truly impact your community. But something I didn't mention before and something for you to consider. Can you do me a favor? If you're getting value out of this video, hit that like button. Next up is corporate employed. So the practice setting where you are an employee of a large corporation that has an organizational structure. And many of these offices have a number of offices in a region or across the country. And we're actually seeing an increase in these corporations and employed opportunities based off the fact that these venture capital groups are coming in and buying existing practices, private practices across the country. It's kind of an exit strategy for a number of private practice doctors, but also they're doing so to continue to build out their network, to build out the number of practices they have, and to decrease their cost of goods and increase their ROI on their marketing budget. And so at the end of the day, though, if you want to be a doctor that practices in a corporate employed space, you really go in, you provide care to patients, you go home, and you don't worry about the day-to-day operations of running the business or, managing staff or doing any of those different things. And opportunities to really grow within these organizations tend to be more leadership roles where maybe you're still seeing patients, but you're helping, bring in new doctors, you're helping develop teams, or you're helping with, the professional relations department. There's a lot of different opportunities within corporations where you can kind of rise the ranks, and it's just a different structure, and it's a growing space in the optometry industry. If you really enjoy providing advanced medical eye care, you should look into practicing in an ODMD practice setting, otherwise known as optometry ophthalmology. So you work in conjunction and partnership with a group of optometrists and ophthalmologists. And the nice thing is that ophthalmology, the vast majority of ophthalmologists see a lot of medical patients just based off their specialty. And, they go and do residencies or fellowships where they really focus or hone in on glaucoma or cataract surgery or corneal surgery or retina. And you have the ability to work in partnership and learn from some people that are really highly regarded experts in those specific surgical spaces. And you can co-manage surgeries, you can practice to the highest level. Just make sure you get into an office where there's good respect and autonomy amongst the practicing optometrists and ophthalmologists. One caveat just to consider is that some offices will bring in optometrists and they may not let them practice to the full level of the care that they can practice to based off of just preconceived notions or prior experiences. But in my opinion, it's a great practice setting if you can find a group of ophthalmologists and optometrists that work well together and respect each other. Kind of piggybacking off of the ODMD setting is a hospital-based optometry practice setting, and a little bit different than just an ODMD setting because there are a number of healthcare professionals that you're working in conjunction with, and it's just a larger group or larger organization that you're working underneath of. And at the end of the day, you could be providing high-level medical care. You could also be practicing in a specific niche within that organization. So you could be maybe part of the specialty contact lens team or your pediatrics team, or maybe providing just primary eye care. But a little different than the ODMD setting, but it is a pretty cool setting to be a part of because you can work really, in conjunction and have a good autonomy with other medical professionals. The next practice setting on the list is working as an optometrist in the VA medical system. And who doesn't want to serve our nation's vets, right? That's a pretty outstanding way to practice. Not to mention, you're going to see a lot of medical eye disease, and it's a really flexible opportunity that provides you with some really nice benefits, including federal holidays, right? Who doesn't want federal holidays off? But I can tell you this, that a lot of the opportunities in the VA system for optometrists tend to go to optometrists that do residencies within the VA. Now, it's not 100%, but if you want to go down the route of practicing as an optometrist in the VA, do a VA residency. It's going to really help you get your foot in the door for these opportunities. If you're somebody who wants to see patients, but also the opportunity to teach and foster the development of the optometrist of the future, you should look at a career as an optometrist in the academia practice setting. And you're thinking, well, is that a practice setting? Yes, because the vast majority of optometrists that work in academia also see patients. They may do a lot of research. They may also provide coursework and run laboratories and a lot of things for the university or college or institution. But at the end of the day, the vast majority of them still see patients. And it's a really cool way for you to give back to the profession by helping develop optometrists of the future. It's a really unique and dynamic way to practice and be an optometrist. These last two are non-clinical, but still, I would say, practice or professional settings as an optometrist. So you can be in the realm of strictly doing research on product development, research on eye diseases, research that specifically helps us move our profession forward. And a lot of this research is done within academic institutions or for big pharmaceutical companies, big medical device companies, but you can be an optometrist that does solely research, and you most likely will not see patients, right? And in some cases, research is done and you still have to perform research and perform clinical studies on patients, but it's kind of a non-clinical role, and definitely a really cool opportunity and something to consider if you feel like maybe providing direct patient care isn't what you want to do and you'd rather start to dig deep into the developments of moving the profession forward. Last but not least is being an optometrist in industry. And again, not a clinical practice modality, but a career path that you can venture down as an optometrist. And I can tell you what, there are a lot of cool things that are always happening in the eye care industry, whether it's advancement with new products, new services, and new technology, new developments that are truly changing the way that we deliver and provide eye care, and also how we improve our patients' quality of life. So if you're looking for a really, in my opinion, rewarding, but also a very unique way to be an optometrist, you can work within the optometrist or eye care industry. I know your head might be spinning because I just went through a number of different practice modalities that optometrists can work within, but I gotta be honest, they're really, really important to understand if you're a pre-optometry student or an optometry student or even a new graduate and you're exploring your options. And here are a couple tips on how to best find the practice modality or practice setting that's best for you. First and foremost, shadow on the front end, right? And I did a couple of videos on shadowing because I feel like job shadowing is such an important way to really learn what you like and what you don't like. In particular, if you have optometrists that are part of your network that work in these different settings, ask them if you have the opportunity to come and kind of be a fly on the wall and just observe and watch and see what you like and what you don't like. I highly recommend that you look into or consider doing a residency. As optometry as a profession is continuing to advance, doing a residency will open a lot more doors than you ever could imagine. Not to mention, you're going to come out and you're going to be that much more comfortable providing patient care. In my opinion, I see it as about 3 to 5 years of experience all wrapped into one highly advanced and highly concentrated year of patient care. So doing a residency is something that really helps open your eyes up to the opportunities that are available within the profession of optometry. Another tip is that I highly recommend you fill in different practice settings than what you are currently practicing in full time. And this is for new graduate optometrists, but a number of you will take a job and your first job will most likely not be your last. So why not fill in a number of different practice settings and learn more about what you like and what you don't like, and see what it feels like to experience and provide patient care in something different than what you signed up for based on your full-time job. It's really going to give you the opportunity to open your eyes to really the vast majority of opportunities that are available within optometry. And last but not least, keep an open mind. There are so many great ways to provide patient care within this profession, and you may not know it, but all of these practice settings have a number of things in common, and they all have differences. But who's to say that you may not enjoy a different practice setting than you're in, or a different practice modality, or that your opportunities may evolve over time based on the advancements in the profession and the way this world is changing and the way technology is changing. So keep an open mind, and by doing so, you'll find the right optometry practice setting that fits your desire and your needs and how you want to provide patient care. My question of the day, what's your favorite optometry practice setting and why? Let me know in the comments below, and stay tuned for my next video where we can reflect and grow stronger together.